On August 20th, the Idaho Department of Health and Welfare put out a press release to warn the public that measles was circulating in Idaho. They found multiple cases of measles with no connection to each other and no out of state travel, indicating that measles is spreading in Idaho from people that don't know they have it. And unfortunately, Idaho has the very lowest vaccination rate among kindergartners for the measles, mumps, rubella vaccine in the entire country, 50 out of 50. The US average is 92.5%. The US median is 91.3% coverage, and Idaho is sitting at 78.5% MMR vaccination coverage. But why do we care? Why is measles such a big deal? One of the most significant problems with measles is just how contagious it is. This is a graph from the Center for Evidence-Based Medicine that compares what's called the R naught for different infections. R naught is an estimate of how many people, on average, a person with measles or another disease might infect. So someone with measles is estimated to infect like about 15 other people before they're done with their illness. This is another graph from the Center for Evidence-Based Medicine that shows an estimate for what percentage of the population needs to be immune to an illness in order to achieve herd immunity and therefore general community protection, depending on the R naught of the disease in question. So if you remember, measles has an R naught of about 15. So if we go up, draw an imaginary line from our R naught of 15, we see that about 90% or over 90% of the population needs to be immune to a disease like measles in order to have herd immunity. And recall that for Idaho kindergartners, the immunity is probably somewhere in the upper 70s down here. For the 2025 measles outbreak, about 13% of cases have been hospitalized, which is a pretty significant number. And for younger kids, people under 5, it's higher than 20%, so more than 1 in 5. Very concerning. About 3 people out of the 1,408 cases that we've clocked have died from measles. So that's a rate of about 2 people out of 1,000 will die, which, to be frank, isn't super high, but anything is higher than we want. And just considering how contagious this disease is, this is definitely nothing Idaho wants. So what can we do to protect ourselves, our communities, and our families? The measles, mumps, rubella vaccine is the safest, most effective way to protect yourself and those around you. You can check to see if you've had the 2 recommended doses of MMR vaccine by checking the docket.care website. If you weren't vaccinated in Idaho, Docket has a couple other states on their app or website that you can check. If none of these are states where you got vaccinated, you can also call a health department from the state you were vaccinated or call the clinic where you were vaccinated to get your records. If you were born before 1957, you are not recommended to get the MMR vaccine because it's considered that you're already immune to measles, because you were probably exposed to the real thing multiple times as a kid, and so you have natural immunity, which is just as good as vaccine immunity. Some people should not get the measles, mumps, rubella vaccine. For example, people who have severe allergic reactions to components of the vaccine, or people with severe immunodeficiency or pregnancy. The vaccine has live virus in it, and so it's not safe for people who have very weak immune systems or who are carrying babies. Measles, mumps, rubella vaccine is recommended starting age 12 months for routine vaccinations, but in special situations, kids can get it as young as 6 months. That's not currently recommended, but keep watching to see if that recommendation changes. So people younger than 1 year old or people with significant immunosuppression or who are pregnant are basically relying on the rest of the community, the people around them, to be immune to measles in order to prevent getting it themselves.